सत्र में बहुत बहुत स्वागत है। हमारे सोमिया ट्रस्ट की शुरुआत सभी लोगों की शिक्षा और स्वास्थ्य से हुई है। शिक्षा को हम विद्या कहते हैं, उसके लिए विद्या विहार बनाया, और स्वास्थ्य को हम आयुर्विज्ञान कहते हैं, उसके लिए आयुर्विहार बनाया। लेकिन इन दो संस्थाओं के अतिरिक्त एक तीसरी भी संस्था है जिसको हम संस्कृति विहार के नाम से जानते हैं। संस्कृति विहार के द्वारा ये ज्ञान यज्ञ पिछले अनेक वर्षों से यहाँ पर प्रारंभ किया जा रहा है और इसमें ज्ञान की आहुति दी जा रही है। और मैं समझता हूँ कि इससे हम सबके बीच ज्ञान चेतना का संचार होगा और आपकी चेतना का ऊर्ध्वारोहण होगा। यहाँ शिक्षा की भी बातें होंगी, धर्म की भी बातें होंगी, स्वास्थ्य की भी बातें होगी। आज का हमारा जो सत्र है वो स्वास्थ्य के लिए ही है। आज के हमारे जो सत्र के जो वक्ता हैं प्रमुख, वो जो है डॉक्टर तमग्न घोष जी हैं। डॉक्टर तमग्न घोष जी MBBS हैं, फ्रॉम वेस्ट बंगाल हैं। उन्होंने MD किया है जनरल मेडिसिन में फ्रॉम ग्रांट मेडिकल कॉलेज एंड JJ हॉस्पिटल मुंबई से। DM किया है कार्डियोलॉजी से फ्रॉम सेठ GS मेडिकल कॉलेज एंड KEM हॉस्पिटल मुंबई से। और अभी जो है करंट में वो जो नाउ वर्किंग एज ए कंसल्टेंट इंटरवेंशनल कार्डियोलॉजिस्ट एट KG सोमैया हॉस्पिटल, एंड इसके पहले वो कंसल्टेंट कार्डियोलॉजिस्ट एट न्यू दिल्ली थे। और इस तरह से उनका एक ये संक्षिप्त परिचय मैंने आपके सामने रखा है। और मैं अधिक समय न लेकर के और हमारे तमग्न घोष जी के स्वागत के लिए हमें आमंत्रित करूँगा हमारी प्रतिभा बेन जी, जो कि यंगेस्ट सिस्टर ऑफ श्री SK सोमैया जी। तो मैं उनसे निवेदन करूँगा कि वो जो है हमारे आज के अतिथि डॉक्टर तमग्न घोष जी, उनका जो है सवाल पहना करके और बहुत बहुत स्वागत करें। जी जी जी, ठीक है जी, ठीक है। अब मैं सीधे ही हमारे अधिक समय का विलंब ना करते हुए हमारे डॉक्टर तमग्न घोष जी से निवेदन करूंगा कि वे अपना जो है प्रस्तुति यहाँ पर जो है प्रस्तुत करें। जी धन्यवाद।
Thank you, sir. So, as we all know कि nowadays आज के दिन में जो यंग में हार्ट अटैक है वो काफ़ी बढ़ गया है। तो मेरा आज का जो टॉपिक है वही है कि what is the reason for that rise in heart attacks in young and what we can do to modify the risk factors. ठीक है। So as we know, heart, it's a machine which never rests. Starting from birth till death, it is always beating, and the main and sole purpose is to give blood supply to all the organs, including your brain, liver, kidney, which helps in functioning. So this is the cardiovascular system. तो बेसिकली जैसे हमने सबने पढ़ा हुआ है स्कूलों में कि जो हार्ट है वो ऑक्सीजनेटेड ब्लड रिसीव करता है लंग से, और उसके बाद ये ऑक्सीजनेटेड ब्लड जो होता है इट सप्लाइज टू ऑल द ऑर्गन्स, एंड ऑर्गन लेवल पे ऑक्सीजन डिलीवर करने के बाद वो हमारे जो वेन्स होते हैं उनसे रिटर्न आता है टू द हार्ट, एंड देन हार्ट सेंड्स दोज डीऑक्सीजनेटेड ब्लड टू द लंग्स अगेन, where it gets oxygenated and comes back to the heart. So that is the cycle which is shown here. All the blue color that is shown, it is basically the deoxygenated blood which is going to the lungs via the heart from the right side of the heart basically, and फिर oxygenate होके red color का जो ये दिख रहा है that is oxygenated blood. So the common cardiac diseases in young adults are congenital heart defects, that is basically जो हार्ट की स्ट्रक्चर होती है उसमें कोई भी प्रॉब्लम, जैसे कि होल इन हार्ट बोलते हैं हम, ठीक है। हार्ट रिदम डिस्टर्बेंस, ये कैसा होता है कि जो हार्ट की नर्व सप्लाई होती है उसमें कोई प्रॉब्लम होता है तो सडनली पेशेंट कोलैप्स होते हुए देखा होगा आप लोगों ने, कि जिसकी हार्ट रेट बहुत ज़्यादा बढ़ गई या बहुत कम हो गई और वो सडनली कोलैप्स हो गया। मायोकार्डाइटिस एक रकम का हार्ट का इन्फ्लामेशन है। आइटिस वर्ड का शब्द का मतलब है इन्फ्लामेशन, और मायोकार्डाइटिस दैट इज हार्ट का जो मसल है उसका इन्फ्लामेशन हो तो इट इज़ कॉल्ड एज मायोकार्डाइटिस। देन कार्डियोमायोपैथी, दैट इज़ हार्ट की जो मसल है उसमें अगर कोई प्रॉब्लम आई, प्रॉब्लम मतलब वीकनेस, जैसे बॉडी में पैरालिसिस होती है हाथ पैर की मसल में, वैसे हार्ट की मसल में अगर होती है तो उसे कार्डियोमायोपैथी बोला जाता है। और जो आज की टॉपिक है अर्ली ऑनसेट कोरोनरी आर्टरी डिजीज, जो कि हार्ट अटैक के नाम से भी जाना जाता है। सो ये आज की मेन टॉपिक है, जिसमें एक हार्ट की जो नाड़ी आप देख रहे हैं उसके बीच में एक रुकावट, जो उसको हमने हाईलाइट किया है, मैग्नीफाई किया है। तो ये क्यों होता है, कैसे बनता है, क्या प्रॉब्लम हो रहे हैं आजकल। तो स्टैटिस्टिक्स पे जाएंगे तो टुडे अराउंड 1 in 5 हार्ट अटैक्स आर सीन इन लेस देन 40 years ऑफ एज ग्रुप, एंड अमॉन्ग देम द मेल प्रीपोंडरेंस, मतलब फीमेल में ज़्यादा है कंपेयर टू द फीमेल, and 45% of the deaths that is occurring in age group of 40 to 69 is because of heart attack nowadays. So who is a young adult? So according to all the studies that are being conducted, 45-year age group के below को young adult बोला जाता है. Even in American Heart Association and National Institute of Health Studies, they are considering 18 to 45-year-old as a young adult. So अगर हम CV disease burden, that is cardiovascular disease burden, that includes heart attack and stroke, has increased by 41% in last 2 decades. The major contribution is because of stroke, ischemic stroke and myocardial infarction, मतलब heart attack और जो paralysis attack होता है. इसके मेन कारण जो मिले हैं वो smoking, inflammatory disorders and diabetes mellitus, sugar. So what has led to this sudden increase in heart attack in the young people? The main is behavioral changes. Behavioral changes, as ये image में दिख रहा है, that is nowadays all our diets that is high in saturated fats. The amount of outside junk food that we are eating, not getting enough physical activity, drinking too much alcohol, smoking and exposure to second-hand smoke. Second-hand smoke includes passive smoking, air pollution. In our cities, the AQ has gone really up. So this is a very significant image where you can see that now sitting is the new smoking. So that sitting is equally bad as smoking. The non-smoker who is sitting all day having trans fats like burgers and pizzas, that is equal to smoking cigarettes. So few statistics. Like as we can see, 1/3 of the world's adult population, young adult population, is physically inactive, and that is due to excessive television and electronic media or social media. A study was done, cardiac study, which showed 80% of the men at the age of 18 were exercising compared to only 40% of female. But in 18 to 30 years, there was a decline in this activity, and men were doing less activity. There was another study known as the Young Finch studies, which showed that TV time is increasing in men during aging, and opposite is happening with female. So this is a very important slide, the signs of heart attack. So one by one I'll discuss. That is, first is cold sweats. So what is cold sweat? Basically, sweating without any humidity or without being summer temperature, like in an AC room, you're still feeling sweaty. Fatigue. Fatigue means excessive tiredness without doing any activity. Lightheadedness. Lightheadedness means having a feeling of sinking, or you may collapse anytime. Nausea and vomiting. It's feeling of even after we consume food or not consume food, you are still feeling nauseating or vomiting. Pain and discomfort in different parts. The pain is mostly, in a case of heart attack, it is central pain in between the chest, and it is like a crushing pain. It's not a pinpoint pain. It's crushing in the mid of the chest, and it's like somebody has kept weight on your chest. And that pain may radiate to your arms, shoulder, mostly the left arm, shoulder, jaw. This is the jaw. Sometimes some patient will only have jaw pain, no chest pain. That is also significant. And it will be associated with exertion, cold sweats, lightheadedness, fatigue, and lastly, shortness of breath. Even simple shortness of breath could be cardiac and not a respiratory thing. So how do you differentiate between a pain of heart attack and a heartburn, that is basically due to gastritis? So as you can see, the pain of heart attack is mostly central part of the chest. It will be associated with exertion or activity like climbing one or two flight of stairs, then you have the pain, and when you sit down the pain gets relieved. But in the case of gastritis, the pain may not be located to the center part of the chest. It may be located, but it may not be. Sometimes it happens in the lower part of the chest, and it will be associated with food intake, sometimes on lying down, and will not be associated with any kind of exertion, and will also not be relieved by rest. So that is the main thing. And apart from that, the radiation of the pain, as we can see towards the left shoulder, jaw, and associated cold sweats, that may not be associated with the pain of heartburn. And heartburns are usually relieved by taking some antacids, but the pain of heart attack won't be relieved. It may be relieved if you take some nitrates which has been prescribed by the doctor for relieving chest pain. So this is a slide, it's getting a bit technical here. It shows how basically block in coronary arteries form. The first slide, as you can see, there is a formation of deposition of cholesterol which goes on forming, and it starts occluding the main lumen of the artery, and then one day when it explodes, that is when there is a plaque rupture and it occludes the whole artery, giving rise to heart attack. In the second slide, there is a narrowing of the artery due to a spasm. That is a temporary situation which may happen in smokers. And spontaneous coronary artery dissection, this is very common in young females. There is no plaque deposition or anything, but there is a tear in the arterial lumen which has led to the narrowing of the artery. These are the three different causes of getting a heart attack. So in a young patient, the most common pathophysiology of heart attack is 80% is due to atherosclerotic disease. Atherosclerotic disease means deposition of cholesterol plaque. 4%, as I said, is because of other causes like coronary anatomy. There is abnormal from birth, there is a defect in the origin of the coronary arteries. 5% is to embolic. Embolic means there is some embolus like a air, like a clot which has gone up from the leg veins into the heart. 5% is due to coagulopathy. There is some people have a hemoglobinopathy, tend to form thrombosis in the coronary arteries. That is again genetic. And 6% is due to spasm, inflammation, radiation, or substance abuse like cocaine abuse. So in clinical presentation in a heart attack, mostly it is seen that the heart attack is less extensive. Less extensive means there are main 3 arteries in our heart. So in young patient, you usually see that only one artery is involved. But as we see in the older age groups, it may be a triple vessel disease. That is all 3 arteries or 2 arteries are involved. So other rare causes, as I already mentioned, cocaine or substance abuse, spontaneous artery dissection, some coagulopathy like the factor V Leiden, Kawasaki disease, even OC pill consumption may lead to a high risk in heart attacks. So these are the risk factors. So the things that are in our hands to change, that is, we can modify your blood pressure, you can modify your blood sugar, you can control your BMI, you can control your inflammation by taking medicines, you can control your diet, exercise, cholesterol levels, you can decrease your smoking, stress. But some things you can't change is your age, family history, the previous history of cardiovascular disease, and your gender. And other factors are the social factors like the environment you're working, income, and social isolation. This again is a pictorial depiction of the last slide only, the main risk factors. So coming to physical activity, the benefits are it will increase your good cholesterol that we call as the HDL, high density lipoprotein. Then there is a less chance of insulin resistance. Insulin resistance is the first step towards diabetes and high triglycerides. It lowers your body mass index. It lowers your glycated hemoglobin, which is a indicator of diabetes, and it decreases your chance of developing hypertension or high BP. Now, what are the goals of physical activity? How much physical activity should be there? So, as per this American Heart Association slide, they recommend at least 150 minutes of moderate intensity activity in a week, or 75 minutes of vigorous activity in a week, or a combination of both. So, as we recommend that move more, sit less. Throughout the day, whatever, if you have a sedentary lifestyle, you keep moving in between your work. Add intensity to your activity, like the faster or the more aerobic exercises, the more amount of muscles you use, the more intense the workout is. Then it is recommended to include moderate to high intensity muscle strengthening exercises, going to a gym twice a week to have a muscle strengthening. But that too should be coordinated with some gym trainer. So the amount of physical activity you do, the more the better you feel. So coming to diet, so this is a very important risk factor. So only as per the data, only less than 10% have the recommended diet, that is the Mediterranean diet. So as we can see, there is a high consumption of butter, sausages, milk, coffee, sugar in the young adults, which gives rise to high levels of LDL cholesterol, ApoB, and the C-reactive protein. So the recommended diet, as you can see on the left side, vegetables, fruits, whole grains, low-fat dairy, fish, poultry, beans, nuts, seeds, and vegetable oils, like the olive oil, mustard oil, in moderation. And we have to limit this: fatty meals, red meats, full-fat dairy, beverages, like the Coke and Pepsi, sweet ice creams, and salt intake, that is sodium intake. So, as you can see, that smoking is a very important risk factor, and nowadays whenever a patient who is less than 40 is coming to us with heart attack symptoms, approximately 70 to 80% are smoker in them. So there is a rise in smoking rates among the young women from African, Asian, and South American continent. The smoking actually gives rise to endothelial dysfunction, that is abnormalities in your heart arteries, increased BP, inflammation, and glucose intolerance. And this increases the risk of ASCVD. Stress and sleep disorders, like mostly seen in 40% of the young men and women. The most common cause is an obstructive sleep apnea or a chronic insomnia, which again gives rise to obesity, insulin resistance, endothelial dysfunction. And nowadays, everybody is in stress. There is a less of sleep, broken sleep. So at least what is recommended is you should get 7 to 8 hours of proper sleep. Obesity, there is a rising trend in obesity seen in 6 to 11-year-old with a male preponderance. And again, obesity gives rise to insulin resistance, chronic inflammation, and arterial stiffness. Obesity is associated with hypertension, with your diabetes mellitus, and ultimately all these two things are leading to heart attacks. Dyslipidemia, this is basically a disorder of your cholesterol levels, and it can basically it can be genetic or familial, which is giving rise to heart attacks in less than 40-year-old. And it can be because of your habits, like diet more in saturated and trans fats. So familial hypercholesterolemia, it can be seen up to 38% of the patients. There is something called ApoB and ApoA1, which are currently, if you do a lipid profile and you include ApoB and ApoA1, then the ApoB-ApoA1 ratio is highly predictive of heart attack. If the ApoB is higher, then that is bad. Then ApoB is a carrier of the bad cholesterol, and the ApoA1 is a carrier of the good cholesterol. So the ratio should be maintained. So in this image, these are the few examples of familial hypercholesterolemia, where you can see there are deposition in the legs and the hands. These are basically cholesterol deposition, which happens in the familial hypercholesterolemia, and also in the cornea, that is eye. So when do we suspect? When there is a family history of early onset CAD, that is similarly less than 45-year people in the family who have got heart attacks. These are the physical signs: tendon xanthomas, that is the fatty bumps which you can see in the hands; corneal arcus, that is white ring around the cornea in the young; very high level of LDL, that is when you do a lipid profile, then it is more LDL cholesterol of more than 190, then you should suspect familial hypercholesterolemia. So hypertension, again, one of the important risk factors. What we see in the young is isolated systolic hypertension. That is, there is a two component, what we call as 120 by 80 is BP. So the upper component, that is 120, is systolic. Usually in young, we can see that the systolic BP is more than 140 and the diastolic BP is okay, 80 or even lower. So that is a risk factor for heart attacks. Now chronic kidney disease, basically chronic kidney disease happens because of hypertension and diabetes, which leads to damage to the filters. Basically our kidney have 2 million nephrons. So in this hypertension and diabetes, they damage these nephrons, that is the filters, and which is associated with high risk of cardiovascular disease in the young. So in diabetes mellitus, which is an important risk factor, according to the NANES study, the pre-diabetes is rising, which is seen in 25% of the young adults of 19 to 34 years of age. Pre-diabetes is a condition where there is insulin resistance, and at that stage you basically need to control your lifestyle so that you don't convert into overt diabetes. That is when you start needing medicines. In pre-diabetes, you can still control your lifestyle and be back to normal. So autoimmune and inflammatory disorders, these are basically one of the rare causes, which is rheumatoid arthritis, Kawasaki's disease. These all systemic lupus erythematosus, these all are inflammation which can lead to heart attacks because of occlusion of your heart arteries, but they are not very common, but still in females it is more dominant. So if any patient of autoimmune disorder, then you should be very careful about your diet and lifestyle, and that your disease is under control. So how to screen a young adult? So basically, if there is a family history of a heart attack in less than 45 years of age, then you should go and screen for your lipid profile at least once in a year. And if there are other causes like diabetes, hypertension, you should have the risk factors under control. And how to know that who is at a higher risk? So there are various calculators which have been there since long time. So one of them is the ASCVD risk calculator, Prevent risk calculator, and some newer calculators like Safe Heart, CAC, PDA. So one of the examples I'll show you. So this is a ASCVD risk calculator where you enter your gender, your age, your race. Basically this has been made by the American Association. So South Asian race is not here, but still you can go with the other. And then you enter your cholesterol value. This is just for an example. This total cholesterol, HDL, that is the good cholesterol, your systolic blood pressure, that is the upper value, whether you're diabetic or not, whether you're a current smoker or not, and whether you are taking any medicine for hypertension. And then they will give you a score based on these entered values. So coming to the score, this is a slide where it is showing the scores. So suppose your value is 0 to 4.9. So that comes under low risk for the next 10 years. So according to this, you don't need any medicine, but you should adhere to the recommended diet and lifestyle. If your score is borderline, like 5 to 7.4, then you need robust lifestyle changes and may need medication if there is a history of heart attack in your family. If there is an intermediate risk, you will need medications, and mostly it is statin to lower the cholesterol levels. And if the risk is high, that is more than 20, then apart from higher statins, you need the higher intensity ones and robust lifestyle changes to prevent the risk. So smoking is the most important modifiable risk factor, and it is associated, as you can see, odds ratio of 3.33 in young adults compared to 2.44 in elderly. Smoking rates among young MI, as I already said, it is 50 to 89%. Now coming to sudden cardiac death. What does it mean? Basically, you must have noted that suddenly someone collapsed in some airport or some marketplace. That is because of a sudden cardiac event. And by this pie chart, that you can see the most important cause of a sudden cardiac death, 75% is coronary heart disease. Coronary heart disease means heart attack, basically cholesterol deposition and its effects. 15% is cardiomyopathy, that is damage to the heart muscle because of some genetic condition, that is DCM, HCM, ARVs. These are genetic conditions. 2% is because of arrhythmias. These are some rhythm disturbances. The heart rate may suddenly go high and suddenly go low. These are also genetic. Then 5% is valvular heart disease. That occurs in the elderly mostly. And lastly, 3% is because of unknown causes. So when you see a person collapsing, so what is the first step? So first we confirm that the patient is not breathing and there is no pulse. We wait for 5 seconds to confirm, 5 to 10 seconds. And then by the time we activate emergency response, that is we call for help. And what is an AED? AED is automatic defibrillator. That is there, sometimes you can see in the airport terminals, there is a AED which gives shock. So by the time we get the AED, we start giving chest compression. So what is the chest compression? That I'll go in the next slide. This is a cardiopulmonary resuscitation. This is the way you should give chest compression, that is in between the chest, that is in between the nipples. That should go 100 to 120 compressions per minute, and you should go deep and fast. That is, deep means how deep? It's 2 inches or 5 centimeters. You really can't measure at that moment, but it should be deep. So this is the hand position which should be there while giving chest compression. Now when you call for the primary responder, then the primary responder checks for pulse, checks for breathing, gives rescue breaths, that is 2 rescue breaths with every, followed by 30 chest compression, and then again checks for heartbeat, and by the time if it is not there, it continues the same process again and again. 30 compression, 2 breaths, and then connects the AED. AED has 2 patches. One is connected towards the base of the heart and one is connected towards the apex of the heart. And then the AED automatically detects the heart rhythm, if there is a rhythm or not there. And then it advises that give shock. Then you have to press the shock button and it will give shock. And then you have to continue the CPR, that is chest compression. This is basically a flow chart which shows how to, whatever I said that about the chest compression, this is to be followed. So now coming to the other aspect which is found in young, that is congenital heart diseases. So in congenital heart disease, basically it will present with complaints of breathlessness, easy fatigability, feeling of tiredness, palpitations, feeling of heartbeat, recurrent lung infection or pneumonia, bluish discoloration of your lips, nail beds, or the clubbing. Clubbing means there is enlargement of the nail beds. That I will show in an image. So the most common heart diseases, congenital heart diseases found in young are, one is called atrial septal defect. So as you can see, there are 4 chambers, and in the upper chamber there is a gap between the 2 which should not be there. It helps in the communication. It actually mixes the 2 blood, that is the oxygenated and deoxygenated blood, and often presents in the 3rd decade of life, that is in the 30s. This is a ventricular septal defect, that is a defect in the lower chamber of the heart. Again, communication between the oxygenated and deoxygenated blood, but this presents earlier in the 1st or the 2nd decade of life. It is patent ductus atrophy, again a communication between the left and the right side. It presents in the first decade of life. So what is the cyanosis? As you can see, the baby is born with this kind of bluish discoloration of the lips, tongue, and the nail beds. And this is clubbing, that is the hypertrophy of the nail bed, it is the enlargement of the nail beds. So the take-home message, this is the slide that I prepared, keeping CAD at mind, that is heart attack in mind. So you should eat well, that is consume a healthy dietary pattern as advised, that is a Mediterranean diet, plant-based diets are advocated. Move, be physically active, don't smoke, and avoid tobacco and substance abuse products. Rest up, get adequate amount of sleep, that is 7 to 9 hours daily. Be calm, control your stress levels. Even in work, if you have some stress, you should have some moments of de-stressing yourself. Lose weight, that is your BMI should be under control. And medicate if necessary. It's not like sometimes we have been started on hypertension medications. We take for a few days, then we stop, we don't monitor. And then we present with an episode of very high BP, with stroke or even heart attack. And lastly, assess the risk. That is, if you have a family history, if you have a patient in your family who had an early onset heart attack, and if that is your first degree relative, you should go and check yourself up. You should have your at least a yearly checkup, which includes the blood cholesterol levels, which includes the HbA1c, CO sugars. And if you know that something is deficient and some medication should be taken, you should consult a physician before taking your own call. Thank you. Mediterranean, yeah. Mediterranean diet, basically, Mediterranean comes from the place. Yeah. Mediterranean, basically, it comes from the place. The diet is mostly based on the vegetables, fruits, olive oil, and less consumption of high-fat dairy products. So, if possible, at least your diet should contain 80% of the time plant-based diet, and 20%, yeah, and 20% of the time you may replace with non-plant based diet. Okay. Yeah. Hmm. No, it's no. For what? For heart rate of 90. At rest, what is your heart rate? Okay. So basically, you don't need to medicate for that. First, you can try steps like physical exercise, and yeah, trying to like basically monitor your heart rate. If it is showing consistently on the higher side, that means even at rest while you are sleeping, if you have a Apple Watch or something like that, if you can monitor your heart rate, if it's sleep it is more than 90, you may take a bit of medication, but it's not just for the precaution purpose. It's not recommended as such. There are no guidelines that you should give medication. But for just for the use, you can see that a heart which is beating fast, it will also have a certain amount of risk that it will pump less amount of blood than it is necessary. When it beats fast, the amount of blood that's ejected is less compared to when it beats at a normal rate. Okay. Yeah, a low dose of medication may improve, but then you need to rule out what is the cause that is behind this. Okay, then you have to further evaluate what genetic is there. If there is some thyroid abnormality, if there is anything like that which is causing the heart, if there is some low hemoglobin, some pain somewhere, some stress, all that factors ruled out, still you have more than 90, even at sleep, then I would recommend a low dose of heart controlling medication. Yeah. So that is okay. 4.5 is still okay. Okay. And so if everything is ruled out and during sleep you are having more than 90, then I would recommend a dose, a little dose of medication that will just control it to some extent so that this high heart rate doesn't cause any problem while you are having an activity. In activity, if it goes more than 130, you may feel your heartbeat, you may feel little giddiness, lightheadedness, all that may. Okay. And if there is nothing, you may safely ignore it also. Okay. No, it won't. I cannot completely say that it will improve heart efficiency, but what it will do, that if you have some problem because of the high heart rate, like some symptoms, you are feeling your heart rate, it will just improve your quality of life. No symptom, then you can safely ignore it. And you may get a monitoring done for a 24 hours. There is something called Holter. Okay, you can just record so that it will record even in your sleep, and they will see during sleep what is the pattern. Okay. Yeah, watches you can wear. You can wear that watch and sleep, and yes, you can wear that watch for a 24 continuously for 24 hours, and then you can see during sleep what is happening. There is nothing compulsory, but one ECG, at least once you can get it done. So you may follow up it later 1 or 2 years after if there is no symptoms. But one ECG just to see that what is your baseline heart rhythm. Heart rhythm you cannot see by other tests. That is only given by ECG. Sometimes a patient may have a heart rhythm abnormality and no symptoms. That can be detected only by ECG. Okay. Yeah, even watches nowadays they set an alarm for irregular heart rate. That is called atrial fibrillation. So even that the Apple Watch is equipped with detecting that, and that is a risk for stroke. High heart rate with irregularity. That is a risk for stroke. If there is only high heart rate and regular, not an issue. High heart rate and irregular, there is atrial fibrillation, which can be detected by these watches if you continuously wear it, because it may come and go. That high heart rate may be present only for a minute, but that 1 minute it will cause the heart to form clots inside its chambers, and that clot will go into your brain and give you a stroke. So that case you need to anticoagulate, give anticoagulation medicine, some blood thinners. So how to know that? The only way is either you wear the watch continuously or get a Holter study, that is a continuous ECG recording for a 24 hours, 48 hours, 72 hours as recommended. Otherwise it's not primarily required. As per guidelines we don't give blood thinners unless we have a previous history. But some old studies have been there where diabetics are being given that. So some recommend, some don't recommend. It's a plus minus. Yeah, because even ecosprin has a risk of. Yeah, some older studies they say it, but now what happened is ecosprin leads to high amount of gastrointestinal bleed. GI bleed, that is bleeding in your stomach. You won't know, but you are bleeding inside. Okay, so you don't recommend unless. No, first thing is your hemoglobin, that will drop. Okay, and if it doesn't drop, then you can do your stool test and etc., which will give that if you are bleeding inside. And even ecosprin has a minor risk of CNS, brain bleed. Okay, if a person is hypertensive, high BP, taking ecosprin, BP is not controlled, and ecosprin doesn't have a very specific indication to give, it may give rise to brain stroke and bleeding in brain. Minor risk, but it's there, less than 1%. Okay, so chalo.